الرحيم. الصلاة والسلام على أشرف الله محمد بن عبد الله وعلى آله وصحبه وسلم. Assalamu alaikum wa rahmatullah, and welcome in this talk, which will be about the imaging of the endocrine system. In this session, inshallah, we're going to discuss the different imaging methods that commonly involve an assessment of the endocrine system. These imaging methods include plain X-ray or plain radiograph, ultrasound or ultrasonography, computed tomography (CT), magnetic resonance imaging (MRI), nuclear medicine or nuclear scintigraphy, or radioisotope scans or study, and angiography. In general, the indications for assessment of the endocrine system include, this is the outline of the general indication for any gland. The first indication for the assessment of the endocrine system may be to diagnose endocrine tumors according to this gland, maybe for diagnosis of CA, head of the pancreas, pituitary adenoma, thyroid tumor, or any other gland tumor, or localization of endocrine active tumor, any active endocrine active tumor such as pheochromocytoma. This is the indication for imaging of the adrenal gland, or thyroid producing tumor. Many condition may reduce hormones from the tissue that normally not producing these tumors, not these hormones. But this may be also indication for detection of this tumor, which produce hormone in abnormal condition, or evaluation of systemic complications. There are many complications for any of these glands abnormality, for assessment of the parathyroid gland, for assessment of the manifestation of the parathyroid on the skeletal system, to look for the skull, for the renal system, for any part that, or for the renal system in the case of nephrocalcinosis, because parathyroid may cause this, or calcification in the basal ganglia. All these complications may be occurred in different glands. Now we are going to discuss the different glands separately. The first gland will be I'm going to discuss is pituitary gland or master gland. The indication for imaging of pituitary gland include when there is a hormonal dysfunction, when there is increased production of hormone of the pituitary gland, or when there is a deficiency of pituitary gland hormone. This is the first indication. Also, to in case of Cushing syndrome, to know what is the cause of this Cushing syndrome. Is it due to adenoma in the pituitary gland, or other causes of the Cushing syndrome, or to assessment of the gross hormone abnormality. This may be deficiency of gross hormone or increasing gross hormone production. As you know, in case of increased gross hormone in the circulation, this causing acromegaly, and when there is a gross hormone deficiency or insufficiency, this may cause failure or impairment of the process in general. Or this pituitary gland imaging may be indicated by visual abnormalities. Also, all of you know this pituitary gland tumor may compress the optic nerve or optic child due to its normal anatomy of the pituitary gland. It is adjacent to the optic nerve or optic child, and this may cause visual abnormality, or most of the patient may present with severe headache, unexplained headache, pituitary gland abnormality, pituitary adenoma or macroadenoma, especially the patient may present with severe headache. Concerning the pituitary gland appearance on the imaging, first you have to know that this pituitary gland assessed by the MRI, and this MRI may be done without contrast. عندنا صبغة contrast that may be given intravenously to enhance the tissue, to detect the abnormality, and sometimes this contrast enhanced. يعني حصل لما أقول لك enhance معناته حصل take of this contrast by the tissue. This pituitary gland characterized by absence of blood-brain barrier between the pituitary gland and the circulation. ايش يعني هذا؟ يعني مثلا إذا أعطينا contrast intravenously, this contrast circulate with the blood and mix with blood. When it reaches the pituitary gland, this contrast normally enhance the pituitary gland. Why? Because there is no barrier, there is no blood-brain barrier between the gland and the blood circulation. So you have to know this pituitary gland normally enhanced by contrast. Why? Because there is no barrier to prevent this enhancement of the pituitary gland. لأنه عندنا many tissue when they enhance with contrast, this is considered abnormal. But for the pituitary gland, this is normal. Normal pituitary gland is enhanced with this contrast. The MRI is superior than other modalities, especially CT, because this MRI demonstrates this pituitary gland with good quality. It has the more contrast resolution compared to CT, and also from the normal position of the pituitary gland. The pituitary gland is located in the sella turcica, in the bone structure within the hypophyseal fossa, which is formed by the sella turcica. When we scan this area with CT, بيحصل لنا حاجة اسمها artifact due to this bone. يعني this is one of the disadvantages of the CT on the bone structure. يعني إذا عندنا area surrounded by bone, this bone causing artifact بيعمل لنا shadow, unwanted shadow. This artifact causing bad quality image. But on MRI, this is not occurred. So the advantage of MRI over the CT is it has a superior contrast resolution. يعني الصورة بتكون واضحة. Contrast resolution is better, and also there is no artifact. This artifact usually seen on CT. This artifact caused by the surrounding bone. Although the CT can demonstrate this pituitary gland, but MRI is the investigation of choice. If there is any suspected pituitary gland abnormality, pituitary adenoma, either micro or macroadenoma or other pituitary gland abnormality, MRI is the investigation of choice for demonstration of this pituitary gland to pick the abnormality, and also this MRI can assess the neighboring structure, the cavernous sinus, internal carotid, the suprasellar, and the sphenoid sinus. All the structures surrounding the pituitary gland can be well evaluated by MRI. So MRI is the investigation of choice for pituitary gland. As you know, pituitary gland is located within the sella turcica, which is a part of a sphenoid bone. This is the sella turcica in which there is a fossa, hypophyseal fossa, in which this pituitary gland is located. Pituitary gland is composed of two parts, anterior part and anterior posterior one, يعني anterior lobe and posterior lobe. And this pituitary gland connected to the optic chiasm with this part, which is called infundiculum or stole or infundibulum. This is connected the optic jazz to the pituitary gland. This is a demonstrates this image demonstrates the cell tertica, which is a groove in which the pituitary gland is located. So the pituitary gland is a small oval shaped structure about 1 centimeter in diameter. You have to look to the position of the cell tertica, which is superior to this sphenoid sinus. This is sphenoid sinus. Sphenoid sinus is located inferior to the pituitary gland. This is a landmark. Usually, we put our hand in the sphenoid sinus and then we look above it. This is the position of the sphenoid sinus. Before the era of the MRI and CT, and before the presence of MRI and CT, the plain X-ray is the only imaging modality that was used in evaluation of the pituitary gland. And as you know, the pituitary gland is a soft tissue structure, and plain radiograph does not demonstrate any soft tissue. Any soft tissue is not demonstrated by this plain X-ray. But when there is any abnormality in the pituitary gland, this may affect the hypophyseal fossa or pituitary gland fossa. This may cause expansion of this fossa. طبعا سابقا ما كان زي ما كان في MRI كان we depend on this X-ray lateral X-ray for the skull. This is a lateral skull X-ray. You can demonstrate this hypophyseal fossa. عندنا normal diameter AP diameter يعني مثلا about مثلا 2 millimeter. When if more than this indicate abnormality within this fossa. طبعا this is now obsolete technique because the CT and MRI replace this technique. لكن سابقا كانوا يعتمدوا على this technique. This is the skull X-ray lateral view demonstrates this hypophyseal fossa, and you can look to the sphenoid sinus, which is inferior to this hypophyseal fossa. The anatomy of the radiological anatomy of the cell tertica and pituitary gland. This is a hypophyseal fossa. This is this is the floor of the cell tertica. This is the floor of the cell tertica, and this is the anterior clinoid process, and this is posterior clinoid process. This is floor, and this is the area of pituitary gland. Remember that this pituitary gland is not seen within this fossa because it is soft tissue. And this is sphenoid sinus. Sphenoid sinus. This is the anterior clinoid process, posterior clinoid process, and the floor of the cell tertica. Floor of the cell tertica. This is the area of the sphenoid sinus. Now we are not using this technique for evaluation of the pituitary gland. We can use this technique for MRI. This is CT axial. Why is this CT? Why this is CT and not MRI? This question for you. This is CT. Are you agree with me?
CT يظهر فيه البون.
Yes. البون كيف لكن? What is the appearance of bone on CT? You are right. You have to look to the bone. This is the appearance of bone on CT. To differentiate between CT and MRI, you have to look to the bone. What is the normal appearance of bone on CT compared to MRI? يعني دائما بنعتمد على هذه to differentiate between them or to discriminate between CT images and MRI. يعني إذا كان عملنا knee, you have to look to the bone. مثلا tibia. If you do a skull X-ray, you have to look to the frontal bone and the calvareal bone in general. So the bone on CT usually very bright, very dense. on CT بنقول very dense. أبيض يسر الناظرين. من لقيت البون ده أبيض مرة. This is CT, not MRI. CT يعني this is the frontal bone, and see the sagittal bone. You can see the bone is very, very, very bright and it's very dense. But this is the main or cardinal difference between CT and MRI. This is CT. Look to the bone. This is temporal lobe, and this is the sphenoid sinus. Above it, you can see this pituitary gland. This is a pituitary fossa, and on which or in which there is a pituitary gland. This is a bones, left cerebellar hemisphere and right hemisphere. So this is the pituitary gland area or pituitary fossa. This is axial, but this is coronal. Coronal is the plane that divided the body into anterior and posterior. يعني كأنه قطعنا part anterior part of posterior. This is the sphenoid sinus. Above it, immediately there is the sphenoid fossa or sphenoid sinus. This is the area of pituitary gland. This is the area of pituitary gland. You can see this hyperdense الخط الأبيض ده. This is the pituitary stalk or infundibulum, which connect the pituitary gland with the optic jazz or optic nerve. طبعا still
دكتور
yes.
في طلاب برا يبون يدخلون.
This is sphenoid sinus above. This is the nasopharynx. This is the sphenoid sinus, and you can look. The pituitary fossa is immediately superior to the sphenoid sinus. Remember this. The MRI is better, and now you can look to the MRI. This is MRI. Why this is MRI and not CT?
التشو باينة ولا؟
Yes, one of the difference is the اللي هو سموها
bone star.
resolution. Yes, the bone is not very dense. طبعا هو ما بيكون very dense، ما بيكون ابيض مرة. بيكون ممكن يكون gray or black according لأنه الام ار اي عندنا حاجة اسمها sequence، يعني عندنا كم تكنيك، لكن المهم ما بيكون مرة bright. يعني it's look to the bone is not يعني this is a vertebra. This is a vertebral مثلا. It's not very bright similar to this. أصلا ما بتلقاها بيضاء مرة. This is you know spine. يكون gray black but never very bright. يعني ما ممكن يكون زي never this bone. And the skull is very black. This is the main difference between the MRI and CT. This is sagittal MRI, and this is the sphenoid sinus. To look for the pituitary, put your hand on the sphenoid sinus. Sphenoid sinus on MRI and containing air appear black also. And superior to it, this is the area of pituitary gland. لاحظ انه البون ما بنشوفها كويس زي MRI يكون black يعني حتى السيرولار سيكا never seen in the MRI. Like you can see the soft tissue very good. This is the resolution of soft tissue. So this is the landmark. This is sphenoid sinus. Above it, this is a sphenoid. This is a pituitary gland. This is pituitary gland connected with infundibulum or stalk. This is infundibulum or pituitary stalk connected it to the optic chiasm. This is optic chiasm. لاحظوا ان infundibulum is the central with the pituitary gland. And you have to know this because when it push inferior or anterior or posterior, this indicate abnormality. This is in the center. This is a pituitary gland, infundibulum, and this is the optic chiasm or optic nerve. The anatomy you have to be aware of. What is this imaging technique? Is it X-ray? Is it ultrasound? Is it CT? Is it MRI? Which?
CT.
Why CT? Yes, why CT?
Dense bone.
Where is the bone? Where is this dense bone?
I think MRI دكتور.
هي MRI لكن for the teaching purposes or يعني المعرفة العامة you have to discuss your colleague to fix this problem. If you look here, this is not bone. This is with this pride, this is fat. This subcutaneous fat. The bone is this black one. This is the bone. And if you look here, this is a spine. This is a part of the spine. So this is MRI. And what is the plane in this one? Is it axial, coronal, or sagittal?
Coronal.
Yes, this is coronal. What is this structure?
Larynx?
Yes, this is an esopharynx. Yes. And what is this? This is a landmark for pituitary gland.
Sphenoid sinus.
Sphenoid sinus. What is the relation between sphenoid sinus and pituitary gland? Pituitary gland is superior to sphenoid sinus. So you have to look superior to it. This is the area of pituitary gland. This is يسموها T1. ليش؟ لأنه لاحظوا إنه CSF لاحقا مهمة، لكن الآن عرفوا إنه this is a T1. يعني ليش؟ لأنه the fluid is dark. لأنه عندنا many sequences of MRI. This is not our issue now. This is a pituitary gland, and if you look, this is a infundibulum or pituitary stalk, which connects the pituitary gland with the optic chiasm or optic nerve. This is a pituitary stalk connected the pituitary gland, and this is T1 with contrast. تذكرت قلنا if you remember إنه contrast, if the patient receive contrast on MRI, the gland enhances contrast. يعني ايش enhance؟ يعني taking the contrast. But this gland taking the contrast لذلك بقت مرة بيضاء. لما نقول لك حصل enhancement معناتها بقت بيضاء on T1 مثلا. But this is T1 with contrast. The pituitary gland taking the contrast. لأنه قلنا this pituitary gland normally enhanced with contrast because there is no blood brain barrier. فهي بقت بيضاء، هي المفترض تكون جراي كده. لكن اخذت الكونتراست لانه هي نورمال انهانس فبقت مور برايت. and this is a permeable stalk and this is the optic chiasm. This is sagittal MRI. Also you can see this is the sphenoid sinus. Above it, this is the pituitary area, and you can see the optic chiasm. Optic chiasm يكون transverse كده connected with perpendicular line, which is pituitary stalk or pituitary infundibulum. What is this imaging modality? You think what? MR or CT?
CT.
And what is this?
MRI.
MRI.
Because in this one you can see these bones. Calvaire bone is very bright. ما بكون اصلا MRI بتلقى this bone is very bright. احيانا بيكون gray، ممكن يكون black according to the sequences، لكن اغلبه بيكون black. كويس؟ لكن never appear like this very bright like this. This is the دائما تذكر this point. This is CT axial and this is MRI sagittal. MRI sagittal طبعا هي T1 with contrast. This is the sphenoid sinus. Above it, you can see this is the area of pituitary gland. Is it normal?
Tumor? No.
Yeah, yes, there is a lesion. There is a adenoma. Most likely to be macroadenoma occupying this pituitary fossa. And this is also on CT. You can look to the cellular and supracellular lesions. This is the region. You can see this, adenoma, pituitary adenoma, which is located anterior to the bones. This is a bones. One of the brain stem. This is bones. Anterior to it تكون موجودة لنا pituitary gland. يعني also you have to know the relation between the pituitary fossa and the bones. Bones is posterior to the pituitary fossa. That is the bones anterior to it. You can see this tumor at the area of the pituitary fossa. This is a pituitary adenoma on CT and this is pituitary adenoma on MRI. This is CT with contrast. زي ما قلنا ال MRI ممكن نعملها من غير contrast واحيانا بكونتراست. Also this CT with contrast because the pituitary gland appear bright. يعني حطينا البيشنت ده contrast فحصل uptake of this contrast كأنه حصل امتصاص this contrast by this lesion فبقت مرة شنو بيضاء. اصلا مفترض نورمالي حتى لو كان فيها تيومر المفروض تكون جراي كده because this pituitary gland have no blood brain barrier. It is enhancing with contrast. لكن هي there is a tumor لأنها big not in normal size. Now we finish the pituitary gland and wow, we're going to jump to other gland, pineal gland. Pineal gland is the midline structure. هي موجودة in the midline between what? Between the two salami. Between the two salami and in the posterior part or aspect of the third ventricle. Isn't this is the normal position? هي موجودة وين? In the midline between the two salami and the posterior aspect of the third ventricle. Is the normal position of the pineal gland. This pineal gland usually calcified. يعني ده بسموه physiological calcification. يعني normal you can this pineal gland can demonstrate calcification. تلقى specks of calcification on the pineal gland area. طبعا calcification أي حاجة فوق calcium it is better to be seen by X-ray or CT. But this is لكن by MRI difficult to be demonstrated. But this calcification is normally seen by the gland, which is almost always visible on CT. But on X-ray, sometimes it may be not visible, لكن almost always visible on CT. دائما ال CT or X-ray لأنه التو تكنيك utilize X-ray. الاثنين المعادلة دي بيستخدموا CT لذلك يشوفوا لنا شنو الكالسيفيكيشن very good يعني. In contrast to the MRI. MRI جميل في شنو؟ in the soft tissue. Also, similar to the pituitary gland, this pineal gland have no blood-brain barrier. ما عندها blood-brain barrier. So it is normal also enhanced with contrast. إذا أعطيت البيشنت contrast وعملت له تصوير بال MRI or CT, this pineal gland normally enhanced with contrast. Can take the contrast because also there is no blood-brain barrier. زي ما قلنا انه pituitary gland the superior or the best imaging modality for assessment of the pituitary gland is MRI. Also for the pineal gland MRI is the modality of choice to assessment of this pineal gland. لكن هي طبعا عندها مشكله في شنو MRI زي ما قلنا هنا عندها not sensitive for calcification. ليش؟ لانه بيظهر بلاك مره ما بتعرف انه زي calcification here. فاذا one of the disadvantages of MRI it is poor in demonstration of calcification عكس CT. لكن still MRI is the modality of choice for evaluation of the pineal gland. لكن إذا في calcification not demonstrated by this CT. How this MRI demonstrated by MRI? عرفنا the normal position in the midline between the two salami and the posterior aspect of the third ventricle. On MRI, this pineal gland appear as small nodule of soft tissue. هي soft tissue زي similar to the pituitary gland. It is a soft tissue structure. The appearance of this pineal gland is of similar intensity to the gray matter. يعني الانتنسيتي بتاعت الappearance بتاعه on MRI قريبة لشنو؟ to the gray matter. هنيجي نشوف الكلام هذا in the MRI. نحن قلنا MRI is the superior or the best imaging technique for assessment of the pineal gland. This is sagittal. نحن قلنا the pineal gland is the midline structure. لاحظوا إن this is sagittal on the midline. You can see the corpus callosum which is located in the mid sagittal. This pineal gland appear as soft tissue. Soft tissue, not مثلا bone, not soft tissue of similar intensity to gray matter. لاحظ الانتنسيتي بتاعته تقريبا الجريمتر of the brain. إذا نعرف this is the normal appearance of the pineal gland. طبعا تكلمنا عن إنه this pineal gland is the midline. But this is مثلا axial CT. This CT you look to the bone. This pineal gland in the midline. in the midline. This is the area of my abnormal pineal gland. لكن there is tumor. But this is the tumor in the pineal gland. لكن احنا نعرف the normal position of the pineal gland. قلنا in the midline between the two thalami. This is the left thalamus and the right thalamus. And in the posterior aspect of the ventricle, this is the area of the ventricle in the posterior, because this is the frontal horn of the lateral ventricle, this one, and this is the ventricle. Is this MRI or CT? This one, MRI or CT? This is MRI. Don't يعني انت look to the bone. دائما هنا مثلا احيانا بيكون في soft tissue بيكون برايد، يعني انت ما الsoft tissue بيكون برايد لانه فوق فات on MRI بير برايد، لكن this is not skull bone. The skull bone is this very black. بيكون it is directly contact with the brain. This is the bone. لكن this is the soft tissue اللي هو fat subcutaneous tissue. This is bright. This is not bone. The bone is directly contact to the brain tissue. The bone here very black. This is the calcareous bone surrounding the brain. And also the soft tissue resolution is better on MRI. This is MRI not CT. يعني ما تتغشى بشنو؟ subcutaneous fat. لكن this is the bone. This is the bone. This is very dense. Also this is the anterior horn of the lateral ventricle focus containing CSF. قلنا the normal position of pituitary the pineal gland, the midline, center midline between the two thalami. This is the left thalamus and this is the right thalamus. Between them, this is pituitary gland. This is located. Now this is abnormal pituitary gland. يعني هنا في tumor برضه. But this is the area of pituitary gland between the two thalami and on the posterior apex of the third ventricle. Third ventricle برضه موجود in the midline. In the posterior aspect of the third ventricle, this is the pineal gland located. This is MRI also. This is the fat. The bone is closely adherent to the brain. This is black one. This is the calcareous bone. لكن this is not bone. عشان ما تقول إنه this is CT. This is MRI. Sagittal. You can look to this phonosinus and the pituitary gland and the posterior infundibulum. And this is the mid sagittal. لاحظ إنه ظاهر إن إذا كان عندنا الساجيتال عملناها laterally كان حيكون this corpus callosum not seen. تعرف إنه in mid sagittal لما تشوف إيش this corpus callosum. And this is the area of the pituitary gland. There is a lesion. There is a lesion here in the pituitary gland. But so this is the pituitary gland area. And also this is the pituitary gland lesion. أهم شيء نعرف the normal position of the pituitary is the pineal gland region. This is the pineal gland region. This is pineal gland region. The pituitary here is superior to the sphenoid sinus. Superior to sphenoid sinus. So this is the normal position of the pineal gland. And on this slide, we demonstrate abnormal pineal gland to look for the position of the pineal gland. The next gland is thyroid gland. As you know, this thyroid gland is located in the anterior cervical region. The thyroid is normally, this thyroid gland usually or normally imaged by ultrasound. يعني usually we start with ultrasound for assessment of the thyroid gland in the concerning the imaging. يعني إذا احتاجنا نعمل thyroid gland imaging, usually we start the initial investigation is ultrasound. Ultrasound can differentiate between the nature of the lesion on the ultrasound. إذا عندنا lesion in the thyroid, this lesion clearly differentiated is it cystic or solid. لأنه دي مهمة جدا in the differential diagnosis. ممكن نعرف إنه this tumor or this lesion is it cystic or solid. Usually we do ultrasound because this can decrease the differential diagnosis, the list of differential diagnosis. Isn't this the main issue of the ultrasound differentiation? Differentiates the nature of the lesion on the thyroid gland. But the use of fine needle aspiration for cytology is the mainstay diagnosis of thyroid cancer. يعني عشان نعرف which is this lesion, is it benign or malignancy, عملنا ultrasound, you have no way to reach the final diagnosis unless we take a biopsy for this lesion. This is fine needle aspiration. احنا قلنا fine needle aspiration جبناها هنا ليش؟ لأنها بتتعامل بالultrasound guidance. We insert the needle into the lesion, not blindly. You have to follow this needle with, usually we done with ultrasound. يعني we put the fine needle into the tumor or the thyroid gland tumor to take a sample for cytological examination. This done with ultrasound guidance, this technique. And this fine needle aspiration is the mainstay of diagnosis of thyroid cancer. يعني ما ممكن نقول this is thyroid cancer unless we do this technique. Also, the other modality that can be done for assessment of thyroid gland is the nuclear medicine or nuclear scintigraphy technique. لكن دائما بنمنع done for investigation of the function. يعني دائما scintigraphy or nuclear medicine help us in assessment of the function of the thyroid gland. Is it well functioned or not this thyroid gland? يعني not for anatomical value, this scintigraphy technique. In any other tissue or any other organ, يعني scintigraphy play very important assessment of the function rather than anatomy. يعني ما بنشوف الاوتلاين كويس كده، لكن بنشوف we can assess the function of the thyroid gland very well by this technique. CT is not usually or commonly used for assessment of the thyroid gland unless there is a retrosternal or intrathoracic extension of the thyroid gland. يعني إذا كان عندنا goiter, huge goiter, extending from the anterior neck into the retrosternal region and intrathoracic region. In this case, we can do CT for assessment of this huge goiter with retrosternal extension or intrathoracic extension. طبعا سابقا كان بنعمل حاجه اسمها thoracic inlet، يعني كان plain X-ray for the chest and thoracic inlet. You can follow the thyroid gland extension into the retrosternal and intrathoracic. لكن الآن بنعمل أكثر حاجة CT, not MRI, not plain X-ray. So plain X-ray also can demonstrate the intrathoracic extension of the goiter or the goiter, but CT done more than X-ray in assessment of retrosternal or intrathoracic goiter. طبعا قلنا for any patient present with thyroid abnormality, the initial imaging technique that usually done is ultrasound. So you have to be aware of the anatomy. But this is the ultrasound for the thyroid gland. The thyroid gland have two lobes. This is the left thyroid lobe and this is the right thyroid lobe, which are connected in the center by the isthmus. And this is trachea. Lateral to thyroid gland, there is the two vessels, the common carotid and jugular vein on the left side, and also common carotid and jugular vein on the other side. And this muscle, it is sternocleidomastoid. لاحظوا انه the echogenicity انا التراسام بنقول echogenicity، يعني the term used for description of the appearance of tissue التراسام بيتكلم عن echogenicity. The echogenicity of the right of the thyroid lobe is higher than the sternocleidomastoid, يعني more bright than sternocleidomastoid. So this is the left thyroid lobe and this is the right, connected by the isthmus, and this is trachea, which is posterior to the isthmus, carotid artery and jugular vein laterally on both sides. So also this is trachea, the isthmus, left lobe, right lobe. This is the common carotid. Common carotid is less in diameter than jugular vein, and also it is a medial compared and the jugular vein is more lateral. But this is ultrasound demonstrates normal thyroid. The two lobes connected to the isthmus and the echogenicity of the thyroid gland compared to the adjacent muscle sternocleidomastoid. The thyroid is slightly hyperechoic than the sternocleidomastoid. As we mentioned, CT قلنا بتتعامل ايش اللي يكون في retrosternal extension of the goiter or intrathoracic. فديس is CT. ليش CT؟ طوال you have to look to the bone according to the area. هسه الان احنا on the neck you can see the cervical spine. It is very dense. ابيض يسر الناظرين. فاذا هذا هو CT. Let's not MRI. This is the trachea. You can see the left and right lobe of the thyroid, which is hugging the thyroid. كأنه حاضنة شنو this is hugging the trachea. This is radionuclide image. This is the nuclear medicine. In the nuclear medicine بنعطي البيشنت دائما شنو intravenous material radioisotope radiopharmaceutical بيحصل لها uptake by the tissue according to the يعني مثلا عملنا thyroid ممكن نعمل بون مثلا الان هنتكلم عن thyroid but this is thyroid scintigraphy or thyroid radionuclide image of the thyroid. There is uptake يعني أخذت الراديو pharmaceutical. But this is a normal left and right thyroid lobe by the radionuclide image. قلنا تذكروا إنه this is a radionuclide image usually give us more information about the function more than the anatomy. يعني حتى الاناتومي ما بيكون clear زي الأذر شنو modality. لكن كان with this technique we can assess the function of the gland more than the anatomy. فمثلا for example احنا عندنا patient present with history of irritability, muscle weakness, sleeping problem, insomnia مثلا, and increased heartbeat palpitation يعني with heat intolerance and diarrhea and weight loss. لو لاحظتوا these symptoms are symptoms of hyperthyroidism, muscle weakness, sleeping problems. So these are طبعا احنا قلنا you have to do ultrasound initially to look for the thyroid gland. To assess the function of the thyroid gland, we depend on the radioisotope study or nuclear scintigraphy for the thyroid. In activation intravenous radiopharmaceutical, and then we scan him with gamma camera, and then we look to the thyroid gland. This is a normal thyroid gland, and also this is a normal thyroid gland, two lobes with uptake. لكن الابتيك لاحظ انه قليل والسايز بتاعه يعني this is the normal size of thyroid gland. But in this one you can see there is increased uptake. كيف يعني increased uptake؟ The thyroid appear more darker يعني كأنها حصل absorption of this radiopharmaceutical more than normal. فبنسميها there is increased uptake. بقت مرة dark compared to the normal. And also there is increased size of this thyroid glands for both lobes. But this is the characteristic of grave disease, which is characterized by what? Increase the size of the gland with increased uptake. يعني تكون مرة flat. Increased uptake of this radiopharmaceutical. This is a grave disease.
دكتور؟
Yes.
نستخدم هنا التراساوند في الحالة هذه.
أي patient جاب ultrasound symptoms and sign of thyroid abnormality, the initial investigation should be done is ultrasound. أول شيء بنعمل ultrasound to assess if there is a lesion, is it cystic, is it solid. نحن قلنا ultrasound differentiate between the cystic and solid nature of the lesion if there. ثاني بعد ذلك بنعمل radioisotope study to assess the function and also help in يعني differentiate diagnosis. But this is example. يعني البيشنت ده اصلا بيكون عملوا له ultrasound before this study. يعني ما بنعمل دائما radioisotope as the initial study. طبعا بعد ذلك according to the case بنعمل radioisotope if there is a diffuse enlargement of the thyroid gland with increased uptake, this is most likely grave disease. ممكن تلقى ايش في الفاصل؟ ممكن تلقى ليجن solitary lesion وين ليجن، ونعرف مثلا نلقاها solid or cystic. في الحاله دي غالبا بنعمل شنو؟ fine needle aspiration or cytology، لكن دي ما بنعمل فيها، بنعمل بس الراديو ايزوتوب وكاريزا دايجنوز. لكن دائما احنا المشكله بتقابلنا لما نلقى سوليتري نديول، نلقى ليجن واحده ما كلها ديفيوز انلارمنت اوف الثيرويد. في الحاله دي بنخاف من المالجنسي، so you have to take a biopsy. لكن اذا كان diffuse enlargement of thyroid by ultrasound وعملنا this radioisotope demonstrates this diffuse enlargement of the both lobes with increased uptake, this is most likely to be grave disease, characteristic feature of grave disease. You got me?
Yes, doctor.
This is MRI. Why this is MRI?
No bone appearance.
No bone.
Vertical spine, not dense.
Yes. This bone is not very dense. Where is the bone? This is the spinous process, and this is the body of the spine. This is the cord. لكن this is the bone. This on CT, this area be very dense, very bright, أبيض مرة. لكن this is now gray. This is MRI. Then you have to look to the bone, and you can see this is the air within the trachea and the both thyroid gland. This is the thyroid gland. Also, MRI can use for assessment of the thyroid gland in addition to ultrasound and CT and plain X-ray. The parathyroid, very small gland. Usually, normal parathyroid gland not seen by ultrasound unless there is a tumor, adenoma, for example. لكن normal parathyroid gland usually not detected by ultrasound. لكن in case if there is a parathyroid adenoma, may be detected or sometimes may be not. But if there is a small parathyroid adenoma, can be detected by ultrasound or sometimes, usually can be missed by ultrasound. It's very difficult to see this parathyroid adenoma by ultrasound. لكن إذا كانت normal parathyroid, difficult to be seen by ultrasound. So the imaging technique that usually done is radioisotope. إذا البيشنت جانا ب symptoms of parathyroid, you can do ultrasound, but usually we are not able to see these parathyroid adenomas if they are. It can be detected, but it can be not. So the most widely imaging technique is radioisotope. فالتراساوند مثلا ممكن يكون عندنا باراثايرويد سيست كبيره زي دي ممكن تشوفها. دي باراثايرويد سيست لما نقول سيست في التراساوند دائما بتكون usually containing fluid، بتكون دارك يسموها انيكوي. This is cyst بيكون عندها وول، واهم شيء بيكون عندها حاجه شادو خلفها ابيض بيسموها acoustic enhancement. لكن اهم شيء انه تلقاها حاجه مدوره او اوفل او راوندد، لكن اهم شيء سوداء مره anechoic. Usually this is a cyst feature of cyst. This is parathyroid cyst. اما this is a solid parathyroid lesion لكن solid not cystic. Cystic دائما بتكون anechoic black, totally black. But this is solid lesion in the area of parathyroid adenoma. But this is adenoma now detected by ultrasound because it is very large. لكن sometimes parathyroid adenoma may be very small and difficult to be seen. لكن try to remember إنه normal parathyroid normal not seen by ultrasound. قلنا دائما بنعمل إيش؟ nuclear scintigraphy. But this is nuclear scintigraphy demonstrates this parathyroid hyperplasia. بقت مرة increase in size with increase uptake. بقت مرة black. And also this is the parathyroid. This is the parathyroid hyperplasia in 15 minutes scan and on 3 hours scan. This is the parathyroid hyperplasia. The next gland is adrenal glands. As you know, there are two adrenal glands, which is the right one is situated above the upper bowl of the right kidney, and the left one is usually situated just anterior to the upper bowl of the left kidney. فعشان كده بنسموها شنو suprarenal gland or adrenal gland. The enlargement of the adrenal gland can be detected by CT and MRI and sometimes or occasionally by ultrasound. يعني it is easily to be if there is a enlargement of the adrenal gland. It is easily demonstrated by CT and MRI and occasionally on ultrasound. طبعا the adrenal gland is more bigger on neonate or the children compared to the adult. يعني بيحصل لها regression. فحتى لما بنشوفها دائما in the pediatric especially in neonate بتكون very يعني easy to be detected. لكن an adult difficult or this adrenal gland by ultrasound. I mean by ultrasound, but it can be recognized easily by CT and MRI. And still, the CT is the best technique for diagnosing adrenal enlargement. Why? Because by CT you can demonstrate the size and shape of the gland. Like also MRI can demonstrate, but CT is best. Radioglide also can be used for localizing functional adrenal tumor. يعني ده لاحظ انه functioning. Radioglide diamond usually assess the function of the glands or other organs. يعني دايما if you are interested in the function, this radioglide plays very important role. Normal adrenal gland are visible in adult by ultrasound. يعني this not rarely seen by ultrasound, as we mentioned. لكن on pediatric or especially in neonate, the adrenal gland can be easily detected by ultrasound, but rarely visible in adults by ultrasound. لأنه قلنا on the adrenal gland is more bigger on the pediatric compared to the adult. What is this imaging technique? Did ultrasound, did MRI, did CT, did plain X-ray? Yes. What is this?
Maybe CT?
CT?
Yes, you are. This is CT, you are right. Why?
Bright bone?
Yes, the bone is very bright. طبعا for orientation CT هي دائما بتكون axial. يعني دائما الصورة بتاعت CT بتكون axial unless we do حاجة اسمها reconstruction. ممكن نعملها على التركيب in other planes sagittal or coronal. لكن this is axial cross section يعني. And this is a usually this is a posterior, the posterior aspect of the patient, and this is the left side of the patient, and this is the right, and this is the anterior. احنا عملنا axial cross section on the abdomen كأنه قطعنا كده axial. This is the left side, and this is the right, and this is superior, and this is the inferior. But this is a posterior. This is a posterior. This is the back يعني of the patient. So this is the spine, and you can see what are these? What are
Ribs?
Yeah, yes,
Ribs?
This is the ribs. So this is, yes, you are right, this is ribs. We have two adrenal glands. The left one, this is the left adrenal gland, and this is the right adrenal gland. The left adrenal gland located between the left kidney and the aorta and the pancreas. Yeah, between these three structures. This is the aorta, and this is the left kidney, and this is the pancreas. This is the left kidney. And the right one located between the diaphragm, this is the diaphragm, and liver and IBC, inferior vena cava. This is the inferior vena cava, this is liver, and this is the diaphragm. This is the right crura of diaphragm. This is a right adrenal gland. Also, this is the left adrenal gland between the left kidney. This is the part of the kidney, and aorta and the pancreas. This is the pancreas. And the right one located between the crura, the right crura of the diaphragm, and IBC and the liver. لاحظوا this is the واحدة بتكون زي inverted Y، واحدة زي يسموها شنو؟ V shape. This is the right and left adrenal gland. What is this imaging technique? Is it X-ray, ultrasound or MRI or ultrasound or what? This is corona type طبعا واضحة. This is corona reconstruction of what? CT. This is, you can see, to look to the bone. This bone is very dense أبيض. This bone is very dense. أصلا في MRI never to see this bone is very dense similar to this. So this is the course of this CT طبعا because the bone is very dense. الآن حتمر علينا MRI. You can easily differentiate between them. This is ultrasound. طبعا قلنا ultrasound on adult difficult to demonstrate the adrenal gland. لكن in neonate you can see. But this is adrenal gland by ultrasound. This is adrenal gland by ultrasound. Not easily يعني the adrenal glands are not easily demonstrated by ultrasound in adults. Like on pediatric or neonate, especially neonate, can be easy. What is this imaging modality? Is it plain X-ray? Is it X-ray? Is it CT? What is this? Take care of this image on this endoscopy.
Nuclear scintigraphy.
Yes, this is nuclear scintigraphy or radiology scan or nuclear medicine. طبعا البيشنت بياخد intravenous radio isotope. بعد ذلك بنصوره نجي نشوف في طبعا normal uptake. لكن this is the right kidney and this is the left kidney. This is the left kidney. Above them يعني by arrow Z point to which, what are these? What are the structure demarcated by this? Yes, this is adrenal gland. Adrenal gland above the kidneys. This is the right kidney and this is the left kidney. You can see this is the adrenal gland اللي هي دارك شوية كده. This is the adrenal gland فيها normal uptake. This is radiology scan demonstrates the adrenal glands, right and left adrenal glands. طيب this طبعا هو قال لك this is MRI. Why MRI not CT not other modality? Yes. Why?
The bone is gray,
Yes.
not in white color, not bright.
Yes. Yes. Not very dense, not bright. يعني بتتذكر إنه not أبيض يسر الناظرين. يعني ما تلقاه أبيض مرة on MRI. لكن on CT لأنه CT تستخدم إكس راي عشان كده تعمل absorption للإكس راي بيظهر أبيض مرة. لكن بس تحاول to look to the bone. هسه هنا الآن عندنا السباين. السباين here is gray, not very bright. Not very bright مثلا زي دي مثلا زي دي يعني okay. This is MRI on coronal. This is left kidney, right kidney, and this is left adrenal gland, and this is the right adrenal gland. This is right adrenal gland. This is also MRI. You can look to the axial. This is axial, the posterior, and this is anterior. This is the left, and this is right. And you can see the bone is not very dense. يعني ما أبيض مرة. And left, this is right adrenal gland and left adrenal gland. This is MRI. طيب, is this CT or MRI? This is CT.
CT.
This is CT.
CT.
Also CT. Yes. You can look to the bone. This is left. This is right. This is posterior. This is يعني back occipation. This is spine and this is anterior. This is the spleen on the left side مثلا. أعرف الحاجات دي مرة عشان اللي قدام تفيدكم. This is there is abnormal, there is a lesion in the region of the of the adrenal gland. There is adrenal gland adenoma. طبعا دي الآن ما مسؤولين منها بس أنت عارف إنه this up the position of normal position of the adrenal gland. Also this is CT clearly you can see the bone. بس بتديك صورة عين للبون according to the area يعني the skull ولا كان neck or the spine or the abdomen. شوف الnormal appearance of the bone. Is it very bright, very dense or not? In the skull يعني take care of the subcutaneous fat بيكون أبيض. لكن أنت try to look to the structure in contact with the bone بيكون black معناتها this is a calcareous bone. Also this is you can see there is a lesion on bilateral adrenal gland lesion. This is a right adrenal gland, this is left adrenal gland lesion. This is the area of left or right adrenal gland tumor. What is the most common primary malignancy that metastasize to the adrenal gland?
Lung cancer.
Yes. Lung cancer commonly, يعني sometimes we can discover the metastasis before the primary one. Sometimes يعني ممكن نجد. Or if there is a lung cancer, you have to exclude the adrenal gland metastasis. لأنه بتحب الادرينال gland. You have to exclude metastasis to adrenal gland. This patient no case of lung cancer with secondary or metastasis to the adrenal gland. The next is, gland is pancreas, because pancreas also have the endocrine function in addition to function in the digestion of the food. Computed tomography or CT is now the mainstay of imaging the pancreas. The can pancreas, acute pancreatitis, chronic pancreatitis, injury of the pancreas, computed tomography is the mainstay imaging of the pancreas. The advantage of CT over transabdominal ultrasound انه عارفين انه البنكرياس يعني surrounded by many bowel يعني especially the transverse is colon and the stomach, and this structure containing air. But this makes the assessment of this pancreas is very difficult by ultrasound. Ultrasound عندها عدو يسموه air يعني ما بتمشي في air. But this pancreas usually covered by the air. Well, in the transverse colon and the air in the pancreas. But دائما عندنا difficulty in assessment of this pancreas by ultrasound. لكن CT can demonstrate the abnormality or the normal pancreas, or if there is any abnormality on CT on the pancreas, very clear. The reason CT is more sensitive for detection of any pancreatic lesion compared to ultrasound. طبعا عندنا تكنيك اسمه endoscopic ultrasound. Ultrasound not يعني عندنا ultrasound can be done by الجهاز اللي بنعمل به بيسموه بروب اور ترانسديوسر اللي هو بنعمل به السكان دي. فده بنسموه ترانس ابدومينال ultrasound. You can look to the pancreas or can you assess the pancreas. عندنا other technique بيسموها endoscopic ultrasound in which there is a special designated probe يعني ما نفس البروب اللي بنعمل به الترانس ابدومينال. حاجه عامله زي القلم كده. We can insert this probe through the esophagus to assess the the مثلا البنكرياس بيسموه endoscopic ultrasound, which is routinely used for diagnosis of pancreatic lesion, and this technique have advantages which can be used for taking a biopsy. In addition to scanning, you can take a biopsy by this technique, by this surgery ultrasound بيسموه endoscopic ultrasound. يعني in addition to scanning of the pancreas, you can take a biopsy by this technique, and this helps us in staging of pancreatic cancer. Now, if there is a lesion, there is a lymph nodes or not. يعني endoscopic ultrasound now بقت هي من الأشياء المهمة جدا in assessment of the pancreas. طيب to talk about the normal position of the pancreas, نعرف البنكرياس هو transverse located in the abdominal cavity. يعني ما هو vertical، هو بيكون oriented horizontally. and عارفين انه عنده head و neck body and tail. The head usually nested in the duodenal lobe on the right side. لأنه عندنا الneck the tail is close to the spleen. The head is nested in the duodenal lobes. but دائما بيكون عندنا difficulties in assessment of the head of the pancreas. لذلك the patient should receive oral contrast. ليش؟ بنعطي البيشنت كونتراست زي الكونتراست اللي اتكلمنا عنه، لكن المره دي اورالي. البيشنت بيشرب الكونتراست دي ليش؟ to opacify the duodenum. يعني الديودينم هيبقى لنا ابيض مره بالكونتراست دي. وin this case you can easily differentiate between the duodenum and the head of the pancreas. لكن اذا ما كان حطينا oral contrast, the appearance of the duodenum and the head of the pancreas are similar. يعني difficult to differentiate. لذلك it is mandatory to give the patient oral contrast for enhancement of this duodenum by contrast, for good quality CT, for easy differentiation between the head of the pancreas and the duodenum. لكن إذا ما أعطينا contrast بيكون difficult. بعد عندنا the body of the pancreas normally located in front of the superior mesenteric and splenic vein. يعني إذا دي مهمة جدا إنه the normal position of the pancreatic body especially, is anterior to what? The superior mesenteric artery and also anterior to splenic vein. In other words, the splenic vein and superior mesenteric arteries located posterior to the pancreas, or the pancreas is located anterior to splenic vein and mesenteric artery. عشان لذلك احنا في الالتراساوند برضه عندنا حاجه اسمها لاند مارك، يعني البنكرياس ده من الديفيكالت ستراكشر تو بي سكان باي التراساوند، يعني دايما بيكون في صعوبه انك تشوف this pancreas. Usually also we put our finger on the splenic vein لانه واضح on the ultrasound. Then we look anterior to it and this is the area of the pancreas. طيب احنا قلنا the pancreas is يعني هو running transversely لكن هو oblique oriented، يعني ما بيكون straight، obliquely oriented. لذلك احنا لما نعمل section after section on CT بنعمل مقاطع cross sectional ما بنلقى كل this all part of the pancreas in one section، لانه هو شنو oblique oriented on the abdomen. ما كان straight كان in one section you can demonstrate all parts of the pancreas. لكن because it is running obliquely you can see the head and part of the body on this section. On the next one you can see نقطع وننزل تحت وتاني تحت وكذا. It is usually the part of the pancreas demonstrated in different sections. يعني نشوفها in one section due to this obliquity of the pancreas and the body. The normal pancreas appearance usually بيكون عنده feathery outline or lobulated outline، يعني ما بيكون smooth، بيكون عنده lobulated outline. This is by CT or ultrasound. At ultrasound, this pancreas appear of uniform echoes. This echogenicity of the pancreas is medium to high to compare to the liver. يعني احنا دائما عشان نعرف انه this pancreas is it normal or not in appearance، يعني on the echogenicity we have to compare it with liver. Usually pancreas بيكون higher، يعني بيكون مرة أبيض شنو من الليفر. فدي is the normal. You can now look to this. أول شيء احنا قلنا إنه this is the superior mesenteric artery and this is the splenic vein. Splenic vein running to form the portal vein. And who joining the superior mesenteric vein to form this portal vein. But this is anterior also and this is posterior. The pancreas is located anterior to what? To splenic vein and superior mesenteric artery. In other words, the splenic vein and superior mesenteric artery are located posterior to this pancreas. This is the pancreas. This is the head, and this is the head, and this is the body, and this is the part of the tail. This is aorta, and this is IVC, and this is the left lobe of the liver. لكن أهم شيء the relation between the superior mesenteric artery and the splenic vein to the pancreas. And also you have to look to the echogenicity of the liver to the pancreas. When the pancreas is higher in echogenicity compared to the liver، يعني تلقاه هو المهم أبيض، ممكن يكون مرة أو يعني medium or too high echogenicity than the pancreas. يعني in this one you can look this pancreas also echogenicity is higher than the liver. Again, this is the splenic vein running to form the portal vein, and this is superior mesenteric artery, both located posterior to this pancreas. What is this imaging modality?
CT.
And this one?
MRI.
Yes, you are right. Thank you. Very good. This is the bone يعني gray but the bone this is vertebral body. يعني لاحظوا هنا كانت كيف هنا كيف هنا مرة أبيض. In addition you can look to the other bone structure اللي هي مثلا ribs. هنا طبعا ما مبينة لأن هي شنو؟ اللي هي black. البون دائما بيكون black. This is the main difference between CT and MRI. And what is this structure?
Pancreas.
This is pancreas. Yes, this is the tail, body, and the head. And this is duodenum. يعني duodenum إذا البيشنت ما أخذ contrast بيكون difficult to differentiate between إذا ما أخذ oral contrast. الduodenum بيكون نفس الدنسيتي بتاعت البنكرياس، لذلك احنا دائما بنعطي البيشنت contrast to differentiate between the head of the pancreas and the duodenum. And what is this structure?
Vein.
Yes, this is splenic vein running transversely to join the superior mesenteric vein to form this portal vein. And this is superior mesenteric artery which are rising from the aorta. This is the aorta, this is superior mesenteric artery. لاحظ انه the splenic vein and superior mesenteric artery are posterior to the pancreas. This is the pancreas, take care of it. Also, this is the pancreas on MRI. Also, you can see the superior mesenteric artery and part of the splenic vein. دي طبعا اتكلمنا عن endoscopic ultrasound، قلنا اللي هي done here in addition to demonstration of the pancreas, it can be used for taking biopsy. But this is endoscopic ultrasound showing this pancreatic mass. بس تعرفوا ان this is endoscopic ultrasound, no more than this. The last تقريبا the ovaries طبعا هي برضه عندها endocrine function. The ovaries, as you know, we have two ovaries on both sides, which are located lateral to the uterus, near to the pelvic side walls. And these ovaries during childbearing years, the ovaries measure about 2.5 to 5 centimeter. But after menopause, they regress in size. They atrophy after the menopause. How these ovaries appear on MRI? These ovaries, طبعا احنا عندنا two ovaries on both sides. The ovaries of intermediate signal يعني هم يعني زي gray كده intensity and often contain multiple high signal follicles. عندها follicles يعني كأنها cyst on T2 weighted image. مهم جدا نعرف appearance انه عندنا two ovaries on lateral to the uterus. The intensity لاحظوا انه قلنا زي intensity لانه MRI بنتكلم عن intensity، on CT بنتكلم عن density، on ultrasound بنتكلم عن echogenicity. But in signal intensity, the ovaries are often intermediate. لكن أهم شيء بنعرفهم بالإيج بالfollicles اللي هي زي cysts, small cysts which are bright or hyperintense on T2. هنشوف الكلام ده practically. أما ultrasound, the appearance of ovary depend on the stage or the phase according to the cycle. But on the early phase of this in the cycle, these ovaries appear with several cystic structure. بيكون عندنا many follicles within the within the ovary. يعني بنعرف انه بيكون عندنا many cystic structure or follicles. يعني around the 8th day of cycle, one of these follicles اللي كان شفناه in early phase بيكون dominant. البي dominant بتكبر about 2 to 2.5 سنتيمتر، بيسموها dominant follicles. بتكون one of these بتكون dominate over others. لكن بتكون شايف الsoft tissue of the two ovaries. طيب at the ovulation طبعا بعد ذاك بيحصل الفوليكلز بيحصل لها rupturing immediately after, and there is بيحصل لها reduction in the size. And this time it can give a corpus luteum. corpus luteum بعد ذاك اذا كان ما حصل لنا pregnancy يحصل لها degeneration. يعني من السلايد بتاعت انه there are different appearance of the ovaries on the ultrasound according to the phase. بس يعني حتى الابيرنس يعني in details كده ما تعرف، تعرف انه there is a different appearance of the ovaries according to the phase of the cycle. طيب this ultrasound واضح إن this ultrasound إن this is a ovary with multiple شنو follicles. الfollicles small cyst زي ما تتذكروا السيست اللي اتكلمنا عنها مع بعض بتكون anechoic but this is a normal follicles. This is كله ده كده ده الأوفري. This is the ovary with normal appearance ovary with multiple follicles. أما دي this is what is this? Is it ultrasound also or other modality?
MRI.
Yes, this is MRI. طبعا عندنا هنا دي حاجة normal هنا anatomical variant اللي هو عندنا septate uterus. اللي هو septate uterus بيكون عندنا septum separating the two horns of the uterus. Usually in normal اليوترس بيكون يعني ما عنده septum، لكن إذا كان divided by septum بيسموها septate uterus. بس عندنا two يعني كأنه عندنا two horns of the uterus. نحن قلنا زي lateral to the uterus we have a two ovary. هم صف tissue لكن containing شنو follicles. follicles دي قلنا بتكون hyper intense يعني bright. these follicles الحاجات البيضاء دي الfollicle within the ovary. but this is left ovary and this is right ovary. نعرفها كيف؟ إنه this is the uterus. this is the area of the uterus in the center lateral to it on two sides bilaterally. عندنا soft the ovaries containing follicles which are hyper intense especially on MRI T2. يعني this is the follicles within the ovary. طيب what is this imaging modality?
MRI.
Yes, you are right. You can see this is the head of the femur. This is the head of the femur, and this is urea bladder, and this is the uterus. Lateral to the uterus, there are two ovaries. Here is the right ovary and this is the left ovary containing follicles. الحشية البيضاء دي follicles, small cyst. Also, this is MRI. You can see the head of the femur, which are not very dense. ما بكون أبيض أصلاً البون in the MRI. And you can see also the uterus in the center between the two ovaries, which containing multiple follicles. Normally, this is a multiple follicles. This is the last slide. If you have any question, if you have any comment, you are welcome.
Doctor, firstly, thank you for your explanation. But I have one question regarding to the CT in pancreas.
Yes. What is your question?
Can you just re-explain the layers, or you said the pancreas in oblique position? We can't get one picture. We need multi-layers or something like that.
Yes, thank you for this question. The pancreas is running obliquely, not straight. يعني from the lateral part is superior than the right one. يعني not straight. يعني عندك two lateral portion are not in the similar height. One is higher than the other. This means this pancreas is running obliquely. If you do a cut, you can go through a part of the pancreas, not whole part of the pancreas. But if this pancreas is running straight, not oblique, يعني the both lateral point are on the similar height. And when we go transverse cross section through this pancreas, you can get a section containing all part of the pancreas in one section. But for this reason, the pancreas is running obliquely. So usually we have a part of the pancreas on the one section, and then we do other section above or below this, and then you can have the other part, and so on. And usually we are not going to have an image containing all parts for this obliquely oriented pancreas. Is it clear? If not, I will explain it in other words. Is it clear?
No, it's clear. Thank you.
Yes. Do you have any comment? Any question? You are welcome. Don't hesitate to answer, to ask. I am ready to answer any question. I tried to put a base for radiology for you, concentrate to differentiate between the different imaging modality, especially on the OSPE. The first question may be usually about the modality. And most of the students have a problem in differentiation between CT and MRI. So you have to look to the board. It is easy to differentiate between the CT and MRI. Ultrasound is straightforward, very clear. X-ray also very clear, but most of the students have a problem in differentiation between CT and MRI. I hope that is now clear for you. Let's try to ask if there is any point not clear. Back and look to the slide. Like if you have no question now or in the next session, we want to discuss the file of OSPE. For you, it is depend on you. If you are ready now, or you can arrange for next session to discuss the file of the OSPE. Your opinion. You can discuss it now or later, as you like, according to your time. I am waiting for 2 minutes. You can discuss it with in your group or to decide. Yes, it's your decision. Yes. Do you hear me?
يس دكتور.
Yes, doctor. Yes, doctor.
Yes.
بس جالسين نتناقش الموضوع.
Yes, okay. I am waiting for you.
اوكي.
اوكي دكتور يقول نبغى ناخذ الحين.
تاخذوا الحين؟
ايوه.
This is a screen, the radiology OSPE.
Yes, doctor.
Okay. Concerning the OSPE, the question, usually there are two questions. The first one about the modality or the study, imaging study or imaging modality. When we say imaging modality, it means is it MRI, is it conventional X-ray, is it fluoroscopy, is it nuclear medicine? And then we say study or exam, مثلا ممكن نقول this is skull X-ray. Skull X-ray. يعني the study usually you have to mention the part and the imaging technique. فمثلا this gives the name of the imaging modality used in the given image. Imaging modality معناتها دايرين تعرف is it MRI regardless of the part. يعني is it MRI, is it CT, is it plain X-ray, is it what? What is this?
X-ray.
X-ray.
X-ray ممكن نسميه plain X-ray or plain radiograph. Plain X-ray or plain radiograph. identify the gland. لاحظ كلمة نحن نقول لهم gland لأنه كلها اللي هي اندوكراين يعني أغلب الأسئلة تكون عن glands. Identify the gland located in this area marked by C. يعني مقصود this area. What is the gland? This is a pituitary gland. The name of the imaging modality used in the given image.
MRI.
This is MRI. Identify this one. A is what?
pituitary gland.
Yes. B, what is B?
Optic chiasma.
Yes, optic chiasm. And this C?
Pituitary stalk.
Pituitary stalk or infundibulum. D?
Sphenoid sinus.
This sphenoid sinus. Very good. Right. Also gives the name of the imaging modality used in the given image.
MRI.
This MRI because you can look to the bone. It is very, very flat. And also the soft tissue resolution is better. Like identify the gland. راح نكتب لك the gland demarcated by the arrow. This one. What is this?
Penile gland.
Optic.
This is a pineal gland. Yes. And what is this?
Sphenoid sinus.
Yes. And what is this?
Pituitary gland.
Pituitary gland.
Gives the name of the imaging modality used in the given image.
Ultrasound.
Ultrasound. Modality معناتها ultrasound. طيب. What is this? A.
Thyroid, I think.
Yeah. Which part? Yes, you are right. Thyroid. Which part?
Left lobe.
Yeah. Usually this is the left and this is the right. يعني أنت كأنك بتعاين الشخص هو أمامك. This is right. This is right. Thyroid lobe. And what is this part or structure?
Isthmus.
Isthmus. And what is this?
Left lobe.
Left lobe thyroid.
طيب what is this?
Parathyroid.
carotid.
Yeah, this is the
Yes,
carotid.
common carotid.
Actually, احنا كنا الباراثايرويد difficult to be seen like ultrasound in normal يعني.
Okay.
And what is this?
Jugular vein,
Jugular vein. And what is this?
trachea.
Yes, thank you. Yeah. قلنا this طبعا نسألكم الحاجات دي أكيد بس عرفوها يعني. أصلا هنزلكم الحاجات ال ABC لكن برضه عرفوها بس. For the sake of the knowledge. But this is the
Yes.
muscle. Sternocleido.
Sternocleidomastoid.
Gives the name of the imaging modality.
CT.
CT. Why?
Bone dense and
Which bone
appearance.
do you see?
Vertebra, I think.
Yes, this is vertebra. This is anterior. This is posterior. Left, right. What is this?
trachea.
Esophagus.
Yes, this is trachea. Trachea لأنه containing air. Containing air. CT والاكس راي قريبات لبعض. both use اكس راي لذلك الاير بيظهر في حتى لو عملت جست اكس راي اللنج بتظهر سوداء ليش؟ لانه containing air. Any air appear very black on CT or MRI or an X-ray. ودي circular structure in the midline on transverse section or cross section بتظهر circular structure containing air. And this is what?
right lobe.
Right lobe of the thyroid. And this is a left lobe of the thyroid. Okay, thank you. This is the name of the imaging modality. طبعا إذا جبنا لك دي بنغطيها كذي ما بنخليها لك. This is MRI. Why MRI? هم قلنا زي ما قلنا to look for the bone. This is a transverse process. This is a spinous process.
دكتور اللي من شوي كيف الرايت لوب؟ هذه من البستيريا تكون هذه؟
Usually on CT this is the left يعني انت كأنك دائما left against your right hand and the right against your left side. This is what is this? طبعا هنديك
trachea.
طبعا احنا اذا جبنا دي بنقول لك انه patient present with anterior neck swelling يعني تعرف انه السكشن at the level of the يعني neck يعني فعلا مرات ممكن المفروض تعرف انت وين الايمج يعني مرات في difficulty ممكن في to localize the area in general. فبنقول لك مثلا patient present with anterior neck swelling يعني تعرف انه this section at the level of the neck يعني زي ما قلت trachea and what is this?
left lobe thyroid.
Yes, and the fourth the right. Thank you. Give the name of the imaging modality.
CT.
Yes. Why?
Bone is dense.
Very dense, very bright, vertebrae and ribs. Like what is this? What is the gland?
Maybe right suprarenal.
Yes, thank you. Right suprarenal or right adrenal, which is located between IVC, liver, and the right pleural diaphragm. And this is what is this?
Left suprarenal.
Yes, this left suprarenal. This is left, and this is right. This is posterior, and this is anterior. What is this?
Pancreas.
It's the pancreas. For the answer your question يعني لاحظ انه البنكرياس هنا بتشوف مثلا منه جزء من القطر ممكن الهيد لان هو اوبليك. السكشن اللي بعده ممكن تشوف الاذر بارت اوف ذا هير يعني لانه هو اوبليك not straight. But this is a CT demonstrate this structure. What is the imaging modality used in the given image?
Nuclear medicine.
Okay.
Yes. ممكن تقول nuclear medicine you are right. Radionuclide scan, nuclear scintigraphy, any. طيب identify the glands demarcated by the arrows.
right and left suprarenal
Yes,
gland.
right and left suprarenal gland or adrenal gland located above the kidneys. Above the kidneys, the right kidney and the left kidney. The imaging modality,
MRI.
طبعا زي ما شايفين البون نوت دينس. which plane؟ لازم لما بسألكم لا هي ما مسؤولة من ما بسألكم لا، لكن أحسن
Sagittal.
Is it sagittal? What is the difference between sagittal and coronal? The sagittal divides the body into which part? Coronal and axial. هم أصلا planes أو يعني هي أنت بتقطع يا تقسم البادي ده into anterior and posterior or into left and right or into superior and inferior. If the law of these يعني planes divides the body into superior and inferior, this will help cross section or transverse يعني عملنا transverse section. لكن if we divide the body into anterior and posterior دي معناها احنا عملنا شنو coronal. If we divide the body into right and left معناته دي عملنا شنو this is sagittal plane. sagittal plane بيكون دائما كأنه زي اللاترال كأنك بتعاين للشخص من الجانب. أما الكورونال كأنك انت بتعاين للشخص وهو واقف أمامك. This is what كأنه شخص واقف أمامك. This is coronal كأنه هو شخص واقف أمامك أنت بتنظر له من الأمام يعني لأنه هو plane divides the body into anterior and posterior. فأنت كأنك بتنظر للشخص واقف أمامك. This is the left and this is the right. The left kidney, right kidney, and A and B pointed to which gland? Suprarenal or adrenal gland. However you أنا عارف إنكم عارفينها لكن طيب what is the imaging modality? Give the name of the imaging modality using this image.
Ultrasound.
أيوة ultrasound. What is this structure or what is this gland? ممكن نقول لك structure or gland.
Pancreas.
سهلة. This is a pancreas. لاحظ إنه هو transverse. طيب this is a aorta, this is a IVC and what is this?
Splenic or superior splenic.
Yes. Splenic vein. Yes, right. Splenic vein طبعا بيجوين superior mesenteric vein عشان يكونوا لنا ايش portal vein. This is a confluence between splenic vein and the superior mesenteric vein. الاثنين مع بعض يكونوا portal vein. And what is this? Yes. What are the landmark for the pancreas? Pancreas is anterior to splenic vein and what? Superior mesenteric artery.
mesenteric artery and
Yes. This is superior mesenteric artery and this is splenic vein. لاحظ انه the pancreas is anterior to both these arteries. زي ما قلنا in other words all these arteries اللي هي superior mesenteric vein this vessel superior mesenteric vein this one superior mesenteric artery and splenic vein posterior to this pancreas. Posterior to this pancreas. This is the left lobe of the liver. طيب what is this? طبعا الثلاثة لكن what is the structure؟ عندنا two vessels in the center in the mid يعني in the midline. The left one is aorta and the right one is IVC.
PC inferior vena cava.
Yes, IVC inferior vena cava. So what is this?
Pancreas.
لا هي أنا قصدي هنا طبعا. This line.
Vein.
Yes, which vein? Which vein this one?
Splenic.
Yes, splenic vein. لاحظ هنا عمل confluence يعني كون هنا portal vein. And what is this vessel?
Superior mesenteric
artery. Yes. And so this is what?
pancreas.
This is a pancreas. This is a pancreas. Landmark بتاعته. What is the imaging modality?
CT.
CT مبينه، قلنا لك بس انت شوف يعني دائما يعني الكلام ان جنرال، يعني اعطوك صوره تشوف انه البون الموجود في الصوره دي ايش، لقيته ابيض مره زي ده معناته سي تي، نوت معناته ام ار اي، لان البون لازم يكون مره ابيض او سي تي. طيب وات از ذس؟ gland.
Splenic
Left
vein.
suprarenal.
This left subrenal, the right subrenal. And what is this?
Pancreas.
This is the pancreas. واكيد عرفتوا دي ايش؟ بالنسبه
Splenic vein.
هاي السبلينيك فين ماشي ماشي لحد ما الى هنا السوبيريور ميزنتريك فين عشان يفهموا لك this portal vein. This is aorta and IVC. What is this imaging modality?
MRI.
Yes. لاحظ انه the bone look to the bone. اصلا ما ممكن تكون زي دي الام ار اي، حتى لو عملنا اي سيكونس. الام ار اي عندها حاجه اسمها سيكونس حتعرفوها لاحقا، كلها ما ممكن البون يكون ابيض. فعملت حاجه اسمها تي 1 ولا تي 2 ولا سي ولا كل السيكونس، اصلا البون ما ممكن يكون مره برايت زي دي، ما ممكن. So what is this structure for this gland?
Pancreas.
This is the pancreas. Akid, this is the aorta and this superior mesenteric artery right probably, and this, you can see a part of this beginning vein. What is the imaging modality? This patient present with female patient present with excessive cycle, for example.
MRI. Ovaries.
Yes, MRI or the ovaries. This is the septate uterus عندنا two holes، لكن this is the ovaries, left ovaries and right ovaries containing follicles البيضاء دي. إذا B pointing to the right ovary and C pointing to the left ovary. زي اليوترس طبعا ما هنسألكم، احنا دائما نتكلم الآن عن الجلاس بيا فقط، يعني other structure ما بنسألكم يعني analysis and the time block. What is the imaging modality?
MRI.
MRI. What is this?
Uterus.
This is the uterus, yes. And what is this?
Left ovary.
Ovaries.
أيوة, and this is the right ovary. طبعا دي coronal. This is the coronal. يعني كأنه أنت تنظر للشخص وهو واقف أمامك كده coronal. This is the coronal. Also, this is MRI. Quite obvious. You can see the ovaries between the uterus between the two ovaries. The ovaries are characterized by presence of these follicles. These follicles. This is MRI. Do you have any question? Is it clear? Any comments?
يعطيك العافية دكتور.
يعافيكم. At any time, if you have any point that need more explanation, don't hesitate. Please contact me anytime.
يعطيك العافية.
عليكم السلام ورحمة الله وبركاته.